Hey everyone, welcome to week 6 for NUR, 2823. I've got my numbers wrong up there and it threw me off. I need to fix that. I know you've had Miss Roberts up until this point, but the way that I do things is I am going to record a lecture. There'll actually be 2 lectures this week, and then I will do a little bit of a review in class. So this week we're working on the nursing process, assessment, and diagnosis. And assessment is something that you've probably talked about a little bit in this class and in 2822 health assessment. So that'll be familiar to you. But then the nursing diagnosis part, which will be the second video, excuse me, that'll be pretty foreign. So make sure you listen to that as well. The way I record lectures, they can only be about 15 minutes. So I will do an assessment lecture and then a diagnosis lecture, but they're all within the same PowerPoint that I posted online. So let's get started. So this is just a diagram of what the nursing process looks like. And this week we're going to talk about assessment and diagnosis. I believe next week we move into planning, implementation, and evaluation. Okay, so we're going to talk about all parts of the nursing process. And the nursing process is really important as you go through nursing, and even after when you graduate, you use the nursing process to think critically. So if I can get my notes to pop up here. Okay, assessment. So accurate assessment is really important. And I always like to ask the students, when do you think assessment starts? Well, the assessment starts as soon as you walk in the room, right? I'm sure you were all assessing me the first day that you came into class, as I was doing the same to you. You know, who's paying attention, who's on their phone, who's doing this, who's doing that, who's asking questions. Um, Same type of thing. It starts right when you walk in the room and you lay your eyes on somebody. So we're collecting information about the patient, validating data. That just means confirming the accuracy of the assessment. There's actually a chart, I believe, in your book, if you look through, that talks about validating data. And then organization, using a framework to establish an organization scheme. You'll get better at organizing data as you go through, as we go to clinical. You'll get into a routine. And I would say that anytime that you do an assessment, a head to toe assessment, you do it the same way every time. That way you don't forget something. Assessment purpose. So why do we do an assessment? Well, we want to establish the baseline information on the patient, right? As soon as I take students to clinical and I assign them patients, the first thing I do is I go around to every patient room and introduce myself, and that's just for me to lay eyes on that patient. And I know exactly what they look like when I came in, so I have an idea of something should happen as the day goes on. Other reasons, you want to determine their normal function, determine presence or absence of dysfunction. What are their strengths? So these are some reasons, or these are some purposes of assessment. Sorry, my slides aren't wanting to click over. All right, setting and environment. Assessment should take place in an environment that is quiet, which is sometimes hard, right? Especially if you have patients who are older, they want to watch TV, it's really loud. We want to make sure there's good lighting. We can see what we're doing while we're in there. Wants to be secluded, no distractions, and we want to close the door. If there's family, we want to make sure and ask them to leave unless it's okay with the patient. A lot of times I will just have the family step out. Hey, we're going to do a quick assessment. It'll take me about 10 minutes and I'll call you back in. And in that way, it doesn't put your patient in a bad situation or a tough situation. There's different types of assessments. Your book outlines these. There's an admission assessment, so if they're going to be admitted to the hospital, it's really determining a baseline. That's a lengthy assessment. There's a focused assessment. That's where we would focus in on a specific problem. For example, let's say I'm working in the ER and a guy comes in with a fish hook in his thumb. Am I really worried about his peripheral pulses in his feet? Probably not. That's probably not the top thing on my list. So a focused assessment, I'm going to work close to that site of injury and what's going on. Time lapse assessment. This is determining change from previous findings. So this is something we kind of do on the floor. You have to do maybe an assessment or two per shift. So we're making sure that, things are still in check there. And then an emergency assessment, determining the presence of life-threatening conditions. So we talk about recognizing clues. You need to know the difference between objective and subjective data. I can tell you right now, there will be questions like this on the test. Objective and subjective. Can you tell the difference? And it's not just, it's going to be like, the hardest part about nursing tests for students is that it's in an example, it's in a scenario, okay? So it's not just like Hays vision and objective data. It's not going to be that simple. So make sure you really understand the difference between objective and subjective data. But objective, vision, smell, hearing, touch. So what we see when we walk in the room, you can walk in a room with a patient and notice a smell. Okay, that's objective data. That'd be something that we observed ourselves. And then subjective is what the patient states, what they feel, their perceptions, their concerns. Those are subjective. It's really important when we get subjective data. I think we're going to talk about this here in just a little bit. That we write that down as what the patient says it is. So, if the patient says, my stomach pain is a 10 out of 10, even though they're sitting there eating Taco Bell, you still put that in there. Just put that in the chart, okay? Patient states their pain is a 10 out of 10. It is what the patient says it is, okay? That's subjective data. That's true. It's happened. I had a patient say that to me once. Effective communication. All right, your book outlines different types of different types of communication, and you need to know the difference between these. So the preparatory phase, this is before the nurse meets the patient. So let's say you come into clinical for the day, and I tell you you've got room 410. It's a 49-year-old female with chest pain. So in that preparatory phase, you're going to go get on a computer and see what you can find out about the patient. You're going to find out what her name is. You're going to find out why she's here. Anything about her, what medication she's taking. That's all in the preparatory phase. Introductory phase, that's when you meet your patient. It's a really important interaction. First impressions are a lot. You're going to learn a lot in those first few minutes when you walk in and say, hey, my name's JC, I'm going to be your nurse today. You're going to see if they're receptive. You can tell maybe if they're in pain. There's a lot of things you can find out in that first interaction. The maintenance phase, nurse and the patient work toward achieving a specific goal. So you've established a relationship and now you're working together to achieve a goal. Maybe we're keeping their pain down. Maybe we're working on a bowel cleanse for a colonoscopy. Okay, but we're working together. And then the concluding phase is when the interview is completed. So maybe at the end of your shift. Different assessment skills. I'm gonna go out on a limb and guess that you guys have talked about these with Ms. Roberts in assessment. But inspection is obviously visual. Palpation is touch. Percussion is when we strike the body surface with one or both hands. And auscultation is listening with a stethoscope. We'll get more in depth on those when we're in class, and I can see you, and we can actually talk a little bit closer about those. There's different sources of data. So the patient is really the primary source of data, unless your patient is unconscious or they have altered level of consciousness. Maybe they're older and they're not really with it, or maybe they have a head injury and they're altered. They have severe pain, or something that doesn't really make data collection possible. That would be the only time that they would not be the primary source of data. And then that's what makes it reliable versus unreliable. If they're confused, that's unreliable. Secondary types of data would be family, any labs that you collected during this time, and the healthcare team. All right, recording data. Recording data is really important. They like to say in nursing, if it's not documented, it was never done. So it's really important that you chart as you go throughout the day. Confidentiality is a big thing when recording data. what happens at the hospital stays at the hospital. You can't take names out. You can't go talk to your significant other about a guy named Gary that you took care of today who, was a below the knee amputee. That's not information that we can share. That's really important that we maintain confidentiality. Validation, clarify their statements, and like I said earlier, anything that the patient says, you put that right in the chart. We don't put feelings in the chart. Our feelings. We put what the patient says in the chart. So patient says, patient states their abdominal pain is a 10 out of 10. Maybe you'll put in some cues in there that the patient was holding their stomach, things like that. But we don't put our feelings in there. Patient said it was a 10 out of 10, but it didn't look like a 10 out of 10. Um, you know, Put exactly what they say. So clarify their statements. Make sure you know exactly what they're saying when you're doing the interview, so you can put it exactly in the chart what you heard, to paint a clear picture moving forward. I used to work for an ER physician that would say, "What's your pain on a scale of 1 to 10?" And 10 is you've been ran over by a bus and you're on fire. And so many patients would still say, "It's like a 9.5." So you'll get some interesting answers when you ask that. But when you record data, it's very matter of fact. That's really important. Now we're going to move on to nursing diagnosis. I'm going to stop this video and start a new one because I cannot explain nursing diagnosis in 3 minutes. So you can hop on over to the next video.